all know, an epidemic is on the rise as the Zika virus enters many islands in the Caribbean, inciting fear in a society still recovering from effects of COVID. What is the Zika virus, you may ask? The Zika virus is a single-stranded RNA virus with two lineages, African and Asian. It is a mosquito-borne virus first identified in Uganda in 1947 in a rhesus macaque monkey by the Rockefeller Foundation. Zika is spread mostly by the bite of an infected Aedes species mosquito, Aedes aegypti and Aedes albopictus.
Mosquitoes bite during the day and the nighttime. A person with the Zika virus can transmit the virus to their partners through vaginal, anal, and oral sex. Zika has been detected in semen, vaginal fluid, urine, amniotic fluid. The following are some symptoms of the Zika virus: a fever, a rash, a headache, joint pain, red eyes, eye pain, and muscle pain. These symptoms can be often confused for the dengue fever symptoms. But for the Zika virus, it's a bit different because the Zika virus symptoms are usually very mild, whereas the dengue fever, it can be very harsh on the body. Most people who get the Zika virus, they are asymptomatic. Now, for those who are showing symptoms, expect to have those symptoms for about several days to a week. So here are some ways you can prevent contracting the Zika virus. The first one is most obvious. Avoid being bitten by the mosquito. So, I know that can be a bit difficult. We live in the Caribbean, it's warm, mosquitoes are everywhere. But what you can do is wear long sleeve shirts, long sleeve pants. Avoid leaving your doors open during the day and the nighttime. Avoid leaving the windows open during the nighttime. So that means turn on the AC, turn on the fan, do anything but leave the windows open. Also, try using mosquito nets and using off sprays on your body to repel the mosquitoes. The following islands are red zones in the Caribbean, meaning these are the islands that are most afflicted by the Zika virus. The Northern Islands and the Great Antilles, we have Jamaica, Hispaniola, Puerto Rico, and the Bahamas. And in the Southern Islands, in the Lesser Antilles, we have Barbados. In the Windward Islands and Leeward Islands, we have Trinidad and Tobago. So, although we might be going through a pandemic in the Caribbean, we all know that tourists will still come to the Caribbean. So, the following are recommendations for travelers who are coming to the Caribbean islands, especially those afflicted with the Zika virus. For pregnant women, it is recommended to not travel at all. For women planning on getting pregnant, talk to your healthcare provider about potential risk. If you've chosen to travel, please be cautious of mosquitoes and prevent mosquito bites and sexual exposure to Zika during and after travel. For men with a pregnant partner, prevent mosquito bites during and after travel. Use condoms or do not have sex at all for the rest of the pregnancy, as Zika can be spread through semen. For men with a partner planning pregnancy, prevent mosquito bites during and after travel. Also, use condoms as well or don't have sex for at least 3 months after returning, as the Zika virus can last in semen for up to 3 months. For all travelers, prevent mosquito bites during and after the traveling. So some of you may be wondering, how did this virus get in the Caribbean in the first place? So it has a very long history. So in 1952, the first human cases were noted by detecting neutralizing antibodies to the Zika virus in individuals from Uganda. Also from the Republic of Tanzania. 2 years later, the virus was successfully isolated from a young Eastern Nigerian girl. The proof that the Zika virus was actually causing human diseases came in 1964, when a researcher in Uganda became sick during his experiment with the Zika strain from mosquitoes. So he concluded that the virus was mild in nature after developing a 5-day pink rash. From 1969 to 1983, the geographical distribution of the Zika virus expanded to Asian countries like Pakistan and Malaysia and India and Indonesia. And until 2007, there were only 14 human cases of the Zika virus with no outbreaks. That changed in April and May of 2007 when the Zika virus spread from Africa and Asia to cause an outbreak in the Yap Islands. Between 2013 and 2014, the virus caused outbreaks in 4 other groups of Pacific Islands: New Caledonia, the Cook Island, Easter Island, and French Polynesia. From one of these outbreaks, the Zika was found in semen of one of the patients from French Polynesia, giving further support for the possible sexual transmission. So in March 2015, Brazil notified the World Health Organization about an illness characterized by a skin rash appearing on the northern eastern states. 7,000 cases were identified by the end of April 2015. The World Health Organization issued an official epidemiological alert in May 2015 after receiving confirmation that the Zika virus was circulating in the country. Things took a turn for the worse in January 2016 after the first diagnosis of intrauterine Zika virus transmissions were reported in 2 pregnant women in Brazil, in which both fetuses were diagnosed with microcephaly. That's a condition characterized by an abnormally small head circumference in the baby. Cases after that gradually declined globally from 2017. However, the Zika virus transmission persists at low levels in several countries in the Americas. So, through intermingling and traveling, it is expected that the Zika virus came to the Caribbean from travelers from America, North America, and travelers from South America. As we all know, the Caribbean is one of the most tourism-dependent regions in the world, especially here in the Bahamas. It is our main industry. Thus, travel-related diseases like the Zika virus has a huge potential negative impact on the economy. What is most unfortunate is that many of these Caribbean countries like Haiti and the Dominican Republic, they are heavily populated with lower class people. Now, the less fortunate families can become burdened with an excessive risk of contracting the virus. Some of them live in conditions that are deficient in water supply, sanitation, and improper waste disposals. These conditions make it more susceptible for them to contract the Zika virus. In addition, the possibility of a pregnant woman from a less fortunate background contracting the virus can push her deeper into poverty, as abortion is illegal in the Caribbean region, and the cost care of children with microcephaly is very expensive. Another issue we face in the Caribbean is our healthcare system management. Despite health sector reforms aiming to increase health systems effectiveness and quality, the surveillance systems in the Caribbean often remain limited in some crucial areas. Surveillance of the Zika epidemic has been particularly challenging for our healthcare systems, as these really rely on passive reportings of symptomatic cases. Hence, many symptomatic and asymptomatic cases are not captured. I hope this information was very helpful and informative to you all, to all locals and travelers. Please oblige to all protocols that we're giving in the video, as this is a pandemic that we're going through, and we wouldn't like to have any unnecessary hospitalizations, especially of any pregnant women. So thank you.